Hi, Dr. Ellery here, and I want to talk about facial cupping and why it might be right for you. Now, why would you want to press a facial cup and squeeze it on your face? There's a couple reasons. First of all, you can activate acupuncture channels and points using facial cupping. So there's channels, and I think of them as kind of like rivers or streams that go through our body, and they run either up our body or down our body and to our arms, to our legs. There's 12 main acupuncture channels and a couple other extras that go up the front and the back, and then even more sub-channels. But those main channels, many of them start and end on our face. And so when we use a cup and we press the cup and release it on the acupuncture point, we not only stimulate that point, but we also stimulate the acupuncture channel. So it's a really simple, easy way to stimulate those points in the comfort of your own home. Another thing that cupping does is that it stimulates chi and blood to flow. So we have problems in our body when chi stagnates, and you might be thinking, what's chi? You can think of it as our vital force. It's something that's not measurable, but we can see effects from it. So when chi starts stagnating, one thing that happens is that we can have facial pain, because we're talking about our pain. We can have pain anywhere in our body when chi stagnates, even if it's like in our stomach. But when it comes to doing facial treatments, we can use cupping to move that pain. If we have pain that doesn't go away, that can be blood stagnation. Other things that happen in the face concerning chi and blood is that if we kind of have dull, lackluster skin, that can be from chi and blood stagnation. So we need to get that circulation flowing through our face. So here's an acupuncture book, and I just want to go through what it says. It says, cupping warms and promotes the free flow of chi and blood. We just talked about that. It dispels cold and dampness. We did not talk about that. And this is probably my own personal favorite use for cupping. What does it mean to dispel damp and cold? Well, I live in Portland and it's damp and cold here, so I feel the effects of those two things. And for me and my face, I wake up with puffy face a lot of days, and puffy eyes, and I also get cold easily. It got better since I learned Chinese medicine and started taking some warming herbs and doing moxa. But if you're someone who tends to be cold, you want to do things that help warm you up. So dispelling cold is one way to get rid of that stuck cold in your body and then allow the warmth to come in. Cold can also cause muscle constriction in our face. So let's say you went out and you're a skier and you are just, cruising down those slopes, and then that next morning you wake up and you have TMJ. The odds is that you have cold trapped in your jaw. And so this is one way to move that pain out of your jaw and get it gone for good. That sounds a lot better than surgery, huh? So those are some indications for why you would want to use cupping. Now, who should not do cupping? This is important. You shouldn't do cupping if you've had injections or fillers in your face. You should just check first with your provider. People who've had facial surgery within a year of trying the treatment, scars can morph and develop for a whole year, so check with your provider for that too. People who tend to get migraines, this can stimulate a migraine because migraines don't like changes in blood and circulation. So if you have migraines, you need to be cautious or avoid cupping and even gua sha treatments. People who are pregnant should be careful too and check in with an acupuncturist. There are some points on the body that are contraindicated for pregnant people, especially, I'm just going to point this one out since it's a common point right at the top of the shoulders is a very descending point, which for people with anxiety and their thoughts are rattling around in their heads, this is a nice one. I have really tight shoulders, so I'm probably that person today. But for pregnant women or people, this point can cause the baby to want to descend. And maybe you want that if you're like 42 weeks pregnant and you're like, get out of here. But for most pregnant women, that's not something that you would want to have happen. So please follow those cautions. Oh, and one last one that I just thought of, burns, including a bad sunburn. If your face has that much heat and it's not healed, you want to be careful doing this kind of treatment. Cuts, burns, wounds, even bad acne. If you have acne that's weeping, bloody, or pustule acne, doing this kind of treatment can slightly increase that chance that those pustules can get infected. And nobody wants an infection in their face. So let's do this safely. It's really safe for most people, so I just wanted to throw out who should not do it so that we can do this as safe as possible. And speaking of safety, there's 2 things I want you to do to stay safe doing this treatment. The first is never ever suction around the eyeballs. There's the orbital rim. When you think about like a skeleton in the black part, that's the orbital rim. And you want to stay away from your eyeballs. Even kind of this area where you have your eyelids, don't go there. And then the second thing that you have to be really cautious about is that you can give yourself a hickey. And if you're suctioning too hard for too long, that's the body's natural response. It's not harmful, but it's maybe unsightly. So rule of thumb, watch your pressure. And there's 2 different moves. One's press release. You want to do it that fast. Press release, press release. You don't want to press and then release, because that's that length of time is what's going to cause that blood to come to the surface, and it's it's unsightly. So let's not do those 2 things and stay safe. And one last safety precaution is that on the neck, you never want to slide. You always want to suction, release, because in the neck we have these arteries and veins in the front, and they can collect plaques. And when plaques dislodge, that's a very, very, very serious thing that can cause a stroke. So we don't want that. It's really easy to not do that, so let's not do it. I want to just tell you all the safety precautions because this is a really fun and easy treatment, but if we're not safe, that's no fun and can be really serious. So let's keep it cool.